Hello, I'm Dr. Leibovitz, your Central Indiana go-to foot doc. And if you're watching this video, you're probably wanting to find out how to treat a stiff big toe joint. That's Hallux Limitus or rigidus. What's the best treatment for a stiff big toe joint? We're going to talk about what actually works and what doesn't. So if you learned something in this video, please hit the like button. If you want more videos about foot and ankle problems and want to fall asleep, hit the subscribe button. So the big picture in the treatment and the goal of this is not just pain relief, it's protecting the joint so it doesn't get worse. By the time you have limited motion in the big toe joint and discomfort, it's already progressed probably for several decades. It's sneaking up on you, and once it's there, it doesn't tend to go away. Treatment options for this are either protection or correction. The protection is conservative care, the easy stuff. Leaving the foot alone, let's change the environment around the foot. And this is very effective, especially if we get to it in the early stages. The focus is to reduce stress on the joint by restricting motion and offloading pressure. We can also modify activity, which will make a big benefit for this. What shoes help with Hallux Limitus? Well, a rocker bottom shoe with a very stiff sole. Let the shoe do the work for you and not the big toe joint. We can also use carbon fiber plates in regular shoes. They'll help stiffen it up, but the rocker bottom is the big key that helps the foot work less. We want to really avoid flexible shoes. If you take the shoe and compress it from toe to heel and it bends in half, not a great shoe for this. Barefoot's not really good either. So modifying your activity is important. If you have an activity that bends the joint a great deal, like an electrician or daycare worker, even yoga activity, you can still do the activity, you just have to change it so the toe doesn't bend as much. Why is this important? Because less bending means less pain. When the toe bends too much, it's going to start wearing itself out. Will orthotics help this problem? They can stabilize the joint and really slow down the progression of that. That's a big added life. That's kind of like a stim pack that keeps adding life to the joint. So the joint life is very short with this. It's very limited. So every step that we protect it, we're adding a step of life to the joint. For every step that we're not protecting it, and the joint's allowed to move to the maximum range, we're chopping off life to this joint. It's already on a short leash anyway, so we want to try to get as much life out of it as possible. Other combinations we can use, there can be anti-inflammatories, the orals not so much. Injectables can give us a short-term relief. We've had really good success with regenerative medicine, and that's laser therapy. That's controlling pain as well as inflammation. So what doesn't work? Well, like I said before, oral NSAIDs are not my favorite to use on this. They usually cause more problems than help. Ice, massage, splints, those will help possibly right now, but they're not going to make any difference tomorrow, next week, next year. This is a bone problem, and soft tissue activity is not going to make much difference. So physical therapy can help if you focus on the mechanics of the foot. If you're only focused on getting more motion in that joint by forcing it to move, that's not helpful. You're just damaging the joint more, and you're going to have more pain by doing that. So if conservative measures don't work, do I need surgery? Is a big question. Well, that really depends on how much activity you're limited, how much discomfort you're in. It really depends on the stage too of the deformity and how much destruction is going on. There's two different types of surgeries we do. One of them is a cleanup procedure. If the joint looks pretty decent, but there's a lot of spurring and limited like door stams in the area, we can remove that. The other one is the joint is so badly destroyed, we can go in there and infuse it. And that is very predictable and a very good surgery. And those are usually people that just keep putting up with it. My tough guy syndromes that keep going on and on until it's too late to actually save the joint. They do have implants for this joint. I'm not a big implant person. The original equipment didn't survive. I can't see how a man-made material is going to survive in the most abused joint in the body. So this condition, when we get it early, we can make a big difference with some real easy care. The clear takeaways, if you wait until the joint is rigid, your opportunities are very limited. You may want to watch, if you haven't seen already, our other video about what creates Hallux Limitus. We have another video that talks about great toe pain, and is it gout or is it Hallux Limitus? I'm Dr. Leibovitz, your Central Indiana go-to foot doc.